So let's talk about all of it with CBS News medical contributor Dr. David Agus. He's going to help us understand the latest. So we just heard Carter report that the patient in California was not diagnosed for days because they were not tested. Where are we on the question of testing and also quarantines? What's the latest?
Well, that patient didn't meet the CDC criteria for testing, so obviously the criteria were wrong. And we are now testing people who present to a hospital with an unexplained pneumonia. The problem is there are not that many tests around. So when you look at the numbers, and this happened in China, we say, well, the death rate was 2.5% in China. It was because they're only testing people who are really, really sick. 81% of people who get this or just have mild symptoms, and so most of them haven't been tested.
So the CDC criteria has now been expanded so that patients like this are tested. But what is the test, and why is it so specialized?
So this is an RNA virus. You have to take it, you have to convert it to DNA, then you have to amplify it and see how much DNA is there. So it's a complicated test, totally doable, but it's new. And so the CDC came up with the first test. There were some issues with it, and the country is slowly getting used to doing it. And it takes a while to get the results.
But you're saying we don't have enough of these tests.
Well, the graphic just said 200 tests in California. We're following 8,000+ people. They don't equal to me.
You know what was so scary, David, is that you thought, okay, if I haven't been to China, which is ground zero, or been in contact with anybody from China or any of the countries that we keep hearing about, Milan, but this case in California, I think, just took it to a whole different level. So how concerned should we really be? Because now I think people in this country are thinking, oh no, who's next? And what symptoms should I be looking for?
So these are heroic doctors.
How scared should we be?
Right. These are heroic doctors who said, forget the CDC criteria. I am testing this patient.
Yeah.
And do you really think it's the first test, the first positive in the country?
No, I don't.
There are many other people who have coronavirus. And unfortunately, for 2 weeks or so, you can be asymptomatic and you can spread this virus. And so, think of it this way. In 8 million years, our genome, the human genome, changed 1% through evolution. This virus does it in a day or two.
But you have to come in contact with somebody who has it,
Exactly.
Right?
You come in contact with someone who has it, and then it can spread. And the problem is the spread can happen pretty dramatically. It's very easy to spread. The death rate is very low with this virus. Most people will survive this virus, but it can spread dramatically. So what we're going to see very soon are quarantines. I know we had mentioned earlier new quarantines in California, but they haven't happened yet. But there will be quarantines in this country. It's not if, but it's when and where. And we're all going to have to prepare for it, right?
So what do you do to prepare?
Very simply, as companies say, hey, what's our work from home policy? Be aware that your children may have to take school from home. Get a week of food, dry food in your house, and be ready for this. There's no reason to panic. We're all going to do fine, but there's going to be a new way of life, and we have to prepare for that way of life.
How do you know if you should be tested?
Well, if you start to have symptoms, that is pulmonary symptoms, a cough, a cold, etc., most of them are going to be a cough and a cold this time of year.
Yeah.
But if they continue to get worse, talk to your doctor about being tested. The test is a swab. And as of next week, we should have more and more tests in the country and more testing places in the country, so it'll be more commonplace to do this.
What do you think about flying and wearing masks? Do you think everybody should be wearing masks? Do those masks make a difference?
Listen, first of all, I'm here. So I flew here, and I am flying home tomorrow. So being on a plane is no different than us talking here. I'm not afraid of flying.
Yeah.
Masks, if you look at Asian culture, you wear a mask when you're sick. So when you cough, you don't get other people sick.
Yeah.
Wearing the mask to prevent getting the virus, to me, doesn't make a lot of sense. If you're coughing, it is a sign of respect to wear that mask, and everyone in our country should. This is a new era, and the era is caring not about yourself, but about your community. If you feel ill, do not go to work. Don't send your kid to school if they have a runny nose. We shouldn't have done that before, but now it's a call for all of us to work together to be part of the solution.
All right. Thank you, David.
Thank you.